Why are GLP-1 injections like Ozempic so effective? Why is it that when we compare these injections to previous weight loss drugs like Orlistat, Xenical, Ally, Rimonabant, Qsymia, Contrave, they blow the competition out of the water? And it seems like it's getting better and better. We have GLP-1 agonists like Wegovy, Ozempic, followed by GLP and GIP agonists, Mounjaro and Zepbound, but we have a triple agonist in the pipeline as well. So what is it that makes them so effective? I'm Dr. Rawat, a physician who regularly prescribes GLP-1 agonists and also founded healthgroupcoaching.com, where I coach clients in a group setting on lifestyle and diet for weight loss. The reason that GLP-1 agonist drugs are so effective is because they are effective at the most core level for managing your hunger. At the gut level, incretin hormones affect your hunger and appetite, but on the brain level, they also have an effect on your dopamine reward systems. And the vast majority of obesity is because of a dysfunction in those two systems. A dysfunction in appetite regulation, which is usually regulated through hormones like ghrelin, leptin, and also a dysfunction in reward systems, which involves dopamine. So there are certain clients who have this insatiable appetite. They naturally end up consuming larger portions of food more often and hence consuming more calories than their peers would. But then there are also those clients who perhaps may have a bulimia disorder. They may also be at risk of other forms of addictions like gambling, alcohol, gaming, and the dysfunction there is more in the reward system, mediated more by hormone dopamine. And GLP-1s work on both of these systems. These are hormones that we produce naturally, mediated by our gut microbiome. However, we've been able to make copies of these hormones and make them last much longer. So instead of that hormone lasting a few minutes naturally in the human body, now you can get it to last for a whole week at much higher levels than the normal physiological levels and result in long-term suppression of appetite, stimulating that feeling of satiety and fullness longer term, but also suppressing that addictive potential. Those people who do more hedonic eating, where they're not eating out of hunger. On average, diet and exercise can result in 5 to 6% weight loss. Most of the other drugs for weight loss have been in the 7 to 10% range, but with Ozempic and Wegovy, average weight loss was around 16%, while with Mounjaro Zepbound, the average weight loss is 22%. Compare this to bariatric surgery, which has approximately a 30% average weight loss. Equally, in order to take these GLP-1 agonist injections safely, you do have to have regular monitoring and a healthy lifestyle.